Diabetic retinopathy, it's an eye complication of diabetes. This is a disorder of the retina or the film inside the eye due to diabetes, due to long-standing diabetes. Patients with long-standing diabetes are the ones who usually develop diabetic retinopathy. In mild cases of diabetic retinopathy, the patients are usually asymptomatic or they do not complain of any eye problems. However, the late stages of the disease can cause blindness. In fact, diabetic retinopathy is the leading cause of blindness among working age population in developing countries. In early stages of diabetic retinopathy, there might not be any symptoms. The patient might have good vision, a 20/20 vision. However, in later stages, the patient may complain of metamorphopsia or distortion in his vision. They may also, if the central vision is also affected, the patient may complain of a blurred vision in that eye. Not all patients with diabetes will develop diabetic retinopathy, and the rate of progression would also be among patients who have diabetic retinopathy would not be also the same among patients with diabetic retinopathy. The risk factors for developing diabetic retinopathy would be poorly controlled diabetes. Also, the longer a patient has diabetes, that the higher his chance of developing diabetic retinopathy. Presence of other vascular diseases such as hypertension, hypercholesterolemia, smoking may also predispose to the development of diabetic retinopathy. Patients with diabetes require annual eye checkup, including a dilated fundus examination to detect or diagnose diabetic retinopathy. Mild stages of diabetic retinopathy require no specific treatment to the eye. However, we advise patients to have stricter control of their diabetes, of their blood pressure, cholesterol levels, in order to prevent progression of the disease. In more advanced stages, injections to the eye or laser may be necessary. In very severe stages of the disease, surgery might be necessary to treat the disorder. Okay, so treatment of diabetic retinopathy is aimed at preserving the vision. Treatment doesn't really reverse the findings in the eye. It hopes to stop the progression, protect the vision. In some cases, in some patients with diabetic retinopathy, they may have swelling involving the center part of the retina. These patients may complain of distortion in their vision or blurring of vision. Patients with these type of patients with diabetic macular edema would need injections to the eye to reduce the swelling, and hopefully that will also improve the vision.